Hi, this is Mark Struthers, and after 2 laminectomies and a spinal cord tumor removed, I can tell you about, oh my aching back. 50 to 80% of people will suffer from back pain at least once over their lifetime. In most cases, time is the cure. Most people will become better in about 6 weeks after they discover the back pain. Some will suffer chronic back pain, and some will suffer back pain due to a pathology, such as trauma or degeneration of the spine. For most people in the golden years, back pain is more common to the sedentary older population. This may be a majority and not a minority of the baby boomer group. Even when you recover from back pain, 69% or 7 in 10 adults experience recurrent back pain within 12 months after recovery from the original back pain. The most common type of back pain is non-specific nerve back pain. This graphic shows us that back pain is increasing in adults in the United States. Let's take a look at some of the causes of low back pain. We begin with muscle or ligament strain, then degenerative joint disease, especially the facet joints, disc disease or a disc herniation, spinal stenosis where the spinal canal is too small, spondylolisthesis where a vertebral body is slipping out of alignment, osteoporosis with compression fractures or microfractures, cancer, infections, and organ-related pain. There are quite a number of different causes for low back pain, and we'll take a look at a few of these. Let's begin with the most logical, muscular back pain. Most back pains are caused by a sprain or strain of the back muscles and ligaments. Pain will be in a discrete area and tender to the touch. It is sort of an aching quality and may involve muscle spasms as well. The pain from a muscle pain is not a shooting pain. Shooting pains are related to different pathology. Now let's look at back pain due to spinal causes. And this can be from spine conditions such as osteoporosis, osteomyelitis, a herniated disc, spondylolysis and spondylolisthesis. You might have facet hypertrophy or ischemia of the spinal cord. Some people are born with congenital spinal problems, but most of the spinal problems result from aging. As we age, we get arthritic conditions and degeneration of the spine. Spinal cord injuries are sometimes due to the size of the spinal canal. Age seems to decrease the diameter of the canal, leaving less room for movement. Some of the pathologies are cervical spondylolysis, osteoarthritis, and congenital anomalies of the spine that cause the narrowing of the spinal canal. This graphic demonstrates the spinal cord and the size of the spinal canal. We can see a normal size and then congenital or cervical spinal stenosis where the canal gets smaller. As the canal shrinks or gets smaller, it impinges on the spinal cord. Vertebral osteomyelitis presents as a subacute back pain that increases over days to weeks. With osteomyelitis, you can have pain in your lower back, and if untreated, you can have a focal weakness, bowel, and bladder problems as a result. The most common of the spinal area is the lumbar spine, and it is usually in men over 50 years of age. Now let's look at facet joint pain. What we're looking at with facet joint pain is an irritation in the area where the nerves project through the facets off of the spinal cord. Back pain is caused by arthritis of the facet joints, and it is felt mostly midline and may spread to the back and to flanks. It also gets worse with bending backward or bending side to side. Here we see a model of the lumbar spine which demonstrates the facet joints and the nerve roots. The vertebral bodies despite being called a short bone, are actually a long bone with end plates of hard bone and a center of cancellous bones. It is also innervated by dorsal roots. The spine is composed of pain-sensitive structures that are supporting bone, nerves, and muscle. There can be pain in the periosteum as well as a sensitive pain in the facet joint. With extreme force, the disc may tear and allow the center or the nucleus pulposus to go out through the tear and push on the spinal cord or spinal nerves. This would be the sharp shooting pain that we talked about earlier. The chemicals of the nucleus pulposa can cause swelling of the nerves, resulting in constant burning pain as well. Let's take a look at some radiographic examples. Even though a disc may be herniated, it does not cause pain unless it's pushing against the spinal cord. This image shows blackened discs at many levels, showing the bulging discs. It also shows the herniation of the disc with spinal stenosis. MRI is particularly good at demonstrating the spinal cord and the disc space, not so much the bone. Here we can see a graphic of the different types of disc herniation. We have disc degeneration, disc prolapse, disc extrusion, and disc sequestration, all of which are termed herniated disc. Always my favorite, trying to pronounce spondylolysis and spondylolisthesis. Spondylolysis can be described as arthritis of the spine. Herein, the bony surfaces may become roughened and bone spurs may develop and intrude upon the spinal canal. Spondylolysis does not allow the vertebra to slip forward. Spondylolisthesis, because it is a damage to both sides of the facet joints, allows the vertebra to slip forward. If there is a slippage, the spinal canal has a kink and is a smaller in area. When this happens, the stenosis occurs and it squeezes upon the spinal cord itself, causing pain. This is the one I hadn't had to have surgery for. A vertebral metastasis is a cancer that is spread. Mine was not cancerous, but it was a schwannoma that was about 2.5 centimeters, and it was a neoplasm or a tumor in the spinal cord. With the cancer on a plain film, the earliest sign of spinal metastasis is the erosion of the pedicles. As you can see here, over a period of time, the vertebral body begins to lose height. As the tumor progresses, it may be seen invading the epidural space and compressing the spinal cord. Although MRI does not show bone very well, it will show a difference in the intensity of the signal coming from the bone. Here we can see the vertebral metastasis, and it presents as a localized, deep, aching back pain. If nerves are involved, the pain occurs in neural distribution. Usually the thoracic spine is the area that is most affected. Epidural spinal cord compression is a medical emergency, and the patient may present with paraparesis, sensory loss, bowel, and bladder involvement. I was taking a plane and all of a sudden I couldn't use my legs. Although I'd been in pain, the schwannoma had finally gotten to a point where it was pressing on the spinal cord and nerves. Typical of a healthcare professional, you wait until it's really almost too late. Speaking of time passing, let's talk about the golden years, because the golden years can be a pain. Low back pain is the most prevalent in people aged 75 and older, approximately 37.3%, pretty close to accurate, not approximate. If it was approximate, I'd say about 40, but that is the total of number of people older than 75 that have low back pain, and it primarily happens with women. As we age, our musculoskeletal system also ages. And over time, we develop osteoporosis, spinal disc narrow, we can end up with kyphosis, joints lose their flexibility and become more susceptible to repetitive stress injuries, and we get a skeletal muscle mass loss. With all this happening, you can see why we get some back pain. Now let's take a look at the cancellous matrix in a normal bone and then compare that to an osteoporotic bone. The changes in the bone actually contribute to osteoporosis, and that is microfractures that are very painful. So as we say, getting old may not be as much fun as we thought it was going to be, all pickleball and the villages in Florida. But why should we care? Well, the reason we should is osteoporosis is common. 44 million Americans have osteoporosis, also known as low bone mineral density. If caught, monitored, and treated early, what we'll find is that the treatments for osteoporosis are very effective. In fact, the fracture rate can be reduced by about 50% in those individuals who have undergone treatments. This may be why a majority of older people are on drugs. No, I'm just teasing with that one. But what do we do for treatment of back pain? Well, walking is the best exercise. Physical therapy for your core stabilization helps. Spinal manipulation and spinal therapy and manual therapy are done with a chiropractor, and we can take some analgesics like NSAIDs and antidepressants and acetaminophen. When we have pain, we can also have an application of heat or ice. Some people try acupuncture and others try corticosteroids. Well, that's got it, so I suspect I'll dance right on out of here and see you next time. Thanks again. This is Mark Struthers.